My name is Beth Kotsovolos, and Matthew, obviously, the previous speaker, is my husband. When you look upon my husband and myself, you may not see the battle scars of the past 2 years, but they are there. Despair, depression, disbelief, anger, suicidal ideation, and post-traumatic stress disorder. They are there. To put it bluntly, the post-Lasik symptoms of severe dry eye and unremitting eye pain almost destroyed our family. My children almost lost their father. As I look upon the panel today, I see that many of you are Lasik surgeons or have close ties to Lasik surgeons. I truly, truly hope that today you can put your vested ties with Lasik aside and be objective and really listen to what we have to say, the people who have walked in the shoes of Lasik failure. So I also ask the media now that you hold the FDA accountable for their decisions regarding whether or not the minority matter. I also ask the media to not stop here and to continue investigating the stories of Lasik failures and shine the light on the link between bad Lasik outcomes and suicidal ideation. Think of the numbers of Lasik surgeries that are done annually. Based on the complication rates stated, Lasik is destroying thousands and thousands of patients and family lives. How many will it take for you to recognize that Lasik cannot continue in its current form? I spoke to a gentleman by the name of Roger from Wisconsin. His brother Robert was a great outdoorsman. He was a champion at Packboro racing. Robert kept a journal in his last months before he took his life. He wrote that the constant, unremitting eye pain, burning post-Lasik was unbearable. He said that the pain was too much to overcome. He couldn't live that way anymore. A young doctor who had Lasik in the summer of 2003 committed suicide in September of 2004. This doctor consulted with many physicians in search of solutions to his post-Lasik visual disturbances. He committed suicide after realizing that the solutions to his physical post-Lasik complications were non-existent. Major Eric J. Rupert is a military physician serving in Iraq. His Lasik surgery was done in July of 2003. He states, "I strongly believe that the loss of tear function, which is deemed an acceptable downside to Lasik surgery, is in fact not at all acceptable for many people who lead active lifestyles." And finally, Linda Knuckles had Lasik surgery in January of 2007. She went from doctor to doctor in her city and experts long distance, trying to find help to get her life back. Linda states in her testimonial, "I could not escape the intense burning, even with my eyes closed. I didn't want to get out of bed anymore and face the day. If this is what my life was going to be like, I wasn't even sure I wanted to go on living. I began to think about death being the only escape from misery. Along with the guilt of choosing to have the ill-fated elective surgery, I had to live with the guilt of what effect this was having on my husband and children. I was an empty shell of my pre-Lasik self and my own personal hell." As I read those words for the first time, I was astounded as to how very similar her words were to my husband's. And listening to all the testimonials today, again, it's just over and over I'm hearing the same thing from Lasik patients who have similar complications. Linda goes on further to explain, 10 years ago I had cancer. Although it was scary and difficult, I got through the surgery and treatment without needing any antidepressants. In 20 minutes, as the advertisers say, all of our lives were permanently altered. It's time for the FDA to stand up and protect the public for whom it is entrusted to serve. Lasik has wreaked havoc upon thousands and thousands of families. The eye is the most vital sensory organ that significantly impacts our quality of life. We use our eyes every second of the day. When you permanently damage a person's previously healthy eyes, that person's physical and emotional state will be significantly impacted. Anyone who states otherwise lacks common sense or is disingenuous. Permanently damaging a person's most vital sensory organ with no Plan B fix is not a straw that breaks the camel's back. It's the 200-pound gorilla that brings most post-LASIK complications.
Would you be able to wrap up?
Sure.
We're on the red again.
I ask that the FDA to begin investigation of post-LASIK depression and suicidal ideation in its clinical sequelae.
Thank you very much.